Premature baby feeding challenges. For a preemie, feeding can be a big challenge to overcome while in the neonatal intensive care unit, NICU. Some premature babies don't have the strength or coordination to breastfeed or bottle feed successfully, and that can hamper their growth. However, preemies can overcome their feeding challenges with a little help. By understanding why your baby is having trouble, learning some simple techniques, and knowing who to turn to for extra guidance, you can get your preemie on track to steadily growing and gaining weight. Although it comes easily to most full-term babies, learning to eat tends to be a challenge for preemies, at least early on. Because they were born early, their muscles, nervous system, and other body parts key to feeding are not fully developed. As a result, taking in and digesting adequate amounts of milk is hard, if not impossible, when many preemies are first born. An estimated 43% of newborns up to 5 months old have problems feeding due to the following issues. Premature babies sometimes aren't born with mature sucking skills. In order to drink milk from a bottle or breast, babies need to have a suck that is coordinated and doesn't interfere with regular breathing patterns. Babies who don't coordinate sucking, swallowing, and breathing well can be difficult to feed. They may start off well, sucking and swallowing with gusto. Suddenly, though, they may realize that it's time to breathe, and they aren't quite sure how. They may choke and gag on their milk or stop breathing entirely until the feeding is paused. Sucking and swallowing milk takes a lot of strength, and babies need to develop the muscles in their tongue and jaw to do this well. Gaining strength often happens as premature babies get more practice, but until then, you may notice your baby nodding off just a few minutes into a feeding session. A preemie without a mature suck and swallow will quickly become exhausted during a feeding. Each feeding session is quite a workout. Preemies have an immature gastrointestinal (GI) tract, which means that even when they are able to take in milk, they might not get the nutrients they need from it. They are also more likely to experience GERD or acid reflux, which means they may spit up a large amount of the milk before they can digest it. Their stomachs are also less proficient than full-term babies at breaking down milk proteins and absorbing amino acids, two important nutrients that aid growth and development. Point 3. Sometimes, preemies develop necrotizing enterocolitis (NEC). This condition is rare but more common in premature babies than full-term babies. In NEC, intestinal tissue becomes injured, inflamed, or otherwise damaged, leading to gaps in the intestinal wall through which dangerous bacteria can enter your baby's bloodstream. When babies are born prematurely, their digestive systems may not be fully developed. As a result, many of these small infants experience feeding difficulties such as problems establishing nipple feedings, at breast or with the bottle. This may occur because the infant can't suck and swallow properly. Gastric residuals, which occurs when babies don't completely empty their stomachs from a previous feeding. Gastroesophageal reflux, which occurs when a small amount of stomach contents, including stomach acid, refluxes or regurgitates into the esophagus. This can be painful to the infant and, when severe, may cause signs of distress such as apnea, a condition in which a baby temporarily stops breathing. Abdominal distension, which is an abnormal enlargement or swelling of the stomach. This distension may be a sign of more severe gastrointestinal problems.